The future of healthcare is no longer just a vision. It's here. While others are still planning for this future, Oracle is delivering it and putting AI in action. We've moved beyond hypotheticals into a world where intelligent systems are a reality, where AI is pervasive and unified data drives smarter, faster decisions at every level, where clinicians are reconnected to what matters most and care is proactive, predictive, and personal. This is a world where Oracle takes all the lessons learned from nearly 50 years of working with the most successful businesses to totally and completely transform healthcare. We've built the industry's first unified enterprise AI platform, connecting electronic health records, financials, workforce, supply chain, and all your data under one intelligent architecture. AI is not just bolted on, it's built in across every part of the system, already advancing clinical assistance and matching patients with clinical trials, simplifying billing, reducing friction between payers and providers, and accelerating predictive value-based care. It gives patients greater insight into their own health and gives doctors more time to focus on them. It's delivering real-time insights and making every touchpoint smarter, every decision more accurate, and every outcome better, from breakthrough discovery to bedside delivery. And at the core, Oracle's AI agents, plus the power to build your own. This is transformation at scale. This is the intelligent continuum of care. This is how healthcare becomes what we've always hoped for. This is AI in action.
Please welcome Seema Verma to the stage.
Good morning and welcome to the 2025 Oracle Health and Life Sciences Summit. This year's theme is AI in action, and that's because AI is changing the world, and Oracle is at the center of this transformation. For us, AI isn't a distant promise for tomorrow. It's here. It's real. A force for today that will define the future. In every industry, artificial intelligence is upending business practices and stands as a strategic imperative for unlocking massive productivity gains. And that imperative means building organizations where AI is fully integrated into core operations to amplify human performance. There is tremendous potential for AI to transform the entire healthcare ecosystem, and that's a good thing because our system is in desperate need of change. AI has the power to fix long-standing problems that have never had a solution, address the unprecedented set of challenges that we face today, workforce, access, and the new ones that will certainly arise in the future. Oracle was built to harness this power for our customers and to give them the ability to unlock the full potential of an enterprise AI strategy that is purpose-built to handle healthcare's unique complexities. And it starts with Oracle's world-leading AI data platform, which collects every piece of authorized data to safely and securely provide the foundation that AI needs to learn, to power our advanced agents, and to let our customers build their own. And on top of the AI data platform, Oracle delivers a complete suite of products that addresses the needs of every stakeholder: patients, providers, payers, pharma, public health, and researchers. And by bringing intelligence and efficiency to every interaction, Oracle enables better care, better results, and powers innovation. And all of this runs on the most innovative and powerful AI cloud infrastructure in the world. Every critical ingredient required to ignite AI to transform healthcare. This is AI in action. But AI is only as good as the data that fuels it. And in healthcare, data is both our burden and our potential salvation. Sometimes we're drowning in data, lots of data, very little signal. Clinicians slog through drop-down menus, duplicate records, submerged in disorganized information, yet thirsting for wisdom. And other times, there's too little data. A patient collapses with chest pain, but the predictive data wasn't there to prevent it. Shelves overflow with expired supplies, while a critical drug runs short. And a patient can't get an appointment with one doctor while another provider has open slots. And a cancer spreads silently because the early signals were undetected. And patients are left to wander blind. They don't know which provider delivers the best care. They don't know if they qualify for a clinical trial that could save their life. And most don't even have access to their complete medical health record. And payers and insurers, they lack the full clinical context to make decisions, creating delays in coverage approvals and payments. And researchers reinvent the wheel because they don't have the visibility into previous experiments and access to real-world data. And the consequences of this data dysfunction are everywhere. Burnout, waste, fractured care, spiraling costs, more and more money spent on administration. In the United States, employer premiums are climbing at the fastest pace in over a decade. Across Europe, Asia, and the Middle East, healthcare spending grows faster than the GDP. So to put AI in action, to truly solve these problems, we must first heal our relationship with data. And that's why at Oracle, we believe data interoperability isn't a feature, it's the foundation. And it's why we are in the final stages of becoming a Qualified Health Information Network, or QHIN, in the United States. It's why we built the Oracle Health Connection Hub to create a national interoperability network, hardened with military-grade cyber defenses. And it's why last year we released our clinical data exchange so that payers and providers can exchange data seamlessly. We're all getting tired of the fax machine. And it's why we are leading similar efforts in other countries, including our award-winning One London project in the UK. But sharing data is just the beginning. A longitudinal patient record brings all the pieces together. And then the next step is turning that record into intelligence. Now, I know that we're all hearing that some EHR companies are saying that they're using AI. But don't be fooled, because not all AI products are created equally, and there are a few major factors that differentiate Oracle's AI approach. First, Oracle's AI isn't bolted on, it's built in. So it's like having GPS built into your car versus that older device that used to clip on your dashboard. Remember that? When it's built in, it's connected to all of the car's data, the speed, the fuel, the traffic, and it doesn't just give directions, it guides the entire trip safely and smoothly. Second is the Oracle Semantic database, built specifically for AI. Uncovering the signals from data is one of the critical benefits that AI offers, but that requires a database technology capable of understanding many different types of data. So databases like MUMPs that were built in the 1990s can't do this. Not now and not ever. The Oracle Semantic database gives us a foundation not just from clinical data, but also coverage rules, coding, research, treatment guidelines, and anything else that our customers want to add. And the Oracle differentiator is that our database allows the AI to work off of live evergreen data. And that's really critical because we all know that medicine and healthcare are changing every day. So just think of the impact that the GLP-1s and new treatments for Alzheimer's have had in just the past few years. And moreover, when the new data comes in, our AI agents automatically adjust. We don't have to retrain our models. Third, and this makes our approach even more powerful, is that on top of the database sits the Oracle Knowledge Graph, and this is Oracle's secret sauce. This is what separates us from our competitors. Our Knowledge Graph provides the critical layer of context for the data, mapping its relationships across the different domains, diagnoses, labs, medications, procedures, payer rules. This knowledge graph is how AI knows that a heart attack and myocardial infarction are the same thing. It knows that diabetes is connected to a hemoglobin A1C lab result. And this web of relationships creates a united platform for an army of AI agents, not just 3 agents with cute little names. That was funny. It's meant to be a joke. Ours are AI agents that can make queries across a wide range of data sources, and when paired with reasoning capabilities of frontier AI models, they can understand instructions, they can draw inferences across the data, and once the human approves its recommendations, they can get the work done. Agents can fill out the prior authorization request, send a prescription, order labs, and even do the billing. And remember in math class where just giving the answer wasn't good enough? You also had to show your work. That's what Oracle AI does. It explains where every decision came from and cites the source of every recommendation. Unfortunately, what we see from our competitors is AI trained on old data, frozen in time. And this AI repeats the mistakes of the past, which means it's taking historical inaccuracies and biases, racial biases, gender biases, and presenting them as truth. And it keeps doctors and patients in the dark about the latest cures and scientific advances. And moreover, their AI is static. There's no ability to adapt to change, whether new codes or new therapies. And in healthcare, that's a big problem, because without this context and frequently updated information, AI can make mistakes and even hallucinate, hindering, not helping providers. But Oracle's AI is superior, designed to see the truth. The semantic knowledge graph was built from the ground up by Oracle, and this is not a bolt-on to older Cerner technology. Our competitors are taking that approach, and that's an epic mistake. For AI to enable impactful action, it must be embedded, and it's why we've been investing in this model since day one of the Cerner acquisition, and now it's here. And that's why our competitors' customers are here, and why representatives from some 20 countries are with us today to learn how AI is in action in healthcare. Last month, Oracle released its Health AI application suite, and inside is a collection of coordinated AI agents that work shoulder to shoulder with providers as a collaborative digital assistant. And so before physicians see their patients, they have a summary of their medical history, complete with citations for every element. And the AI can communicate with natural language, so providers can just talk to it, instead of focusing on their computer screens and clicking and cutting and pasting. And the agent will respond just like in a conversation. The new Oracle EHR is voice first, and the record writes itself. The AI listens ambiently as the conversation unfolds. It proposes the right billing code, the right lab, the right medication on what's covered by the payer, and even identifies clinical trial that the patient qualifies for. And the system identifies care gaps and the next best actions based on payer contracts, helping providers maximize quality and outcomes. And the new Oracle Clinical Content Store allows clinicians to freely and easily choose which guidelines and content that they want in their workflows. And it could be one of their own or one from a specialty society or from wherever they want. Physicians can develop and monetize their own proprietary pathways with providers all over the world. Maybe a protocol to treat diabetes or a new way to triage patients in the ER. And Oracle is just the chassis for sharing best practices around the world. And so today, you will see not only the ambulatory EHR, which we're going to be previewing, but we're also going to show the acute EHR, which is planned for completion next year. But while we are proud of what our new EHR can do for clinicians, our commitment to the patient experience is at the center of everything that we do. And Oracle is working to completely reimagine patient engagement through our new portal, giving patients access to their complete medical records and putting the power of AI in their hands. And you're going to hear more about that later. But creating sustainable provider organizations requires extending intelligence beyond the EHR. And Oracle's ERP and our new workforce AI agents use real-time data on patient acuity, census, and staff qualifications to recommend optimal staffing levels days in advance, to reduce safety risks, prevent burnout, and to maximize efficiency. Supply chain AI agents ensure that critical supplies are available to prevent delays in care due to supply shortages. And this isn't reactive scrambling. This is proactive intelligence. This is AI purpose-built for healthcare. But the transformation of healthcare won't be complete without reimagining the rev cycle, the revenue cycle processes. Today, rev cycle is a labyrinth from the 80s. Claims denied, resubmitted, corrected, denied again, delayed payments, surprise patient bills. And we believe many, if not all, revenue cycle functions can happen right inside the EHR. And so today, we will be demonstrating Oracle's new autonomous reimbursement system. AI agents that verify benefits, that give patients a clear estimate of cost, that ensures accurate coding, that sees denials coming and corrects errors before claims are submitted. Our application of AI in revenue cycle aims at resolving the friction between payers and providers. And so we're going to start with prior authorization and real-time claims adjudication. And I'm proud to announce that many of the top insurance companies in the United States have agreed to share their rules on prior authorization so that we can help our providers submit cleaner requests for more denial-free care. And when an approval isn't likely, the payers will be able to share other care pathways that are approvable. But Oracle's mission extends beyond the clinic. It involves closing the gap between clinical care and clinical research. Our goal is to foster a new era of innovation, accelerating new cures and treatments, a vaccine to prevent cancer, a cure for arthritis or malaria, and to do so by leveraging real-world data from clinical care, creating more opportunities for providers and patients to participate in research. And so today, we are previewing our life sciences AI data platform. It will enable secure access to Oracle's 120 million real-world data set, which contains longitudinal patient records that include genomic data. Pharma and research organizations will be able to accelerate drug discovery, enhance the design of their trials, discover new indications for drugs, monitor the post-market efficacy of their therapies, and so much more. Our platform allows providers to combine their own clinical data with our real-world data and then use our embedded intelligence, pre-built insights, and AI reasoning agents to create and conduct studies without the need for hundreds of data analysts and reducing project timelines from months to days. And we haven't forgotten about public health, as much as we would all like to put COVID in the past. The pandemic did make it clear how critical it is to have real-time access to data for public health surveillance, safety monitoring, and to be able to directly connect educational messages and information into patient portals. And so our platform will include specific modules for nations and states to use real-world data to further public health efforts. And we're also working to transform the entire clinical trials process. First, our new life sciences AI application suite, planned for release next year, will simplify clinical trials. Oracle's AI agents will assist in designing trial protocols, forecasting enrollment, and predicting which sites will perform well. They'll monitor a trial's progress, flagging risks before they become failures, and automating protocol changes across sites seamlessly. Predictive models enhance safety reporting, and we can bring in data from any EHR into our data collection system to reduce data entry and to improve data integrity. And inside our EHR, AI agents are screening patients for clinical trials, alerting physicians so that they can discuss trial opportunities in real time. And patients can choose if they want to be informed of trials in their portal. But today, I am really excited about the new way that Oracle will enable clinical trials to be conducted. Right inside the EHR, with no need for a separate system for data collection or reentry. The Oracle Clinical Trial Suite, which is planned for 2027, will allow any of our EHR customers to participate in clinical trials using ambient listening tools to populate data. It will allow pharmaceutical companies and researchers to quickly start trials with our EHR customers. And it will provide a valuable new source of revenue for many community and rural hospitals that today cannot reap the benefits of participating in clinical research. As powerful as our applications are, we know that Oracle can't solve every challenge on its own, and the future belongs to open, extensible platforms where innovation compounds. There are no walls in our garden. And that's why the Oracle AI Agent Studio and the Oracle Health Marketplace are embedded into our products. The Agent Studio allows customers to create their own agents, tuned to their data, their workflows, and their patient populations. The marketplace then makes those innovations shareable and capable of being monetized. Any analytics company can contribute to predictive models to prevent readmissions or increase medication adherence, and our open APIs allow for this to happen. Openness means that the best ideas spread faster, not dependent on one vendor's roadmap, but available to everyone. Now, transformation doesn't stop with technology. We understand that even when a new idea is better, it's hard to go through the process of change. And there's no doubt that AI is going to change everything. Oracle is committed to making this change easier by accelerating the time and reducing the cost of implementation for our new products. Already, our new clinical AI agent and digital exchange only take a couple of weeks to implement. And depending on the size of the organization, we expect implementation of our AI application suite to take anywhere from a few months to less than a year. But technology alone, however rapidly implemented, also won't be enough. It must be accompanied by holistic business transformation, reimagining how work gets done. With AI agents doing more of the work, we need to rethink what is needed from people, refocusing humans from doing routine tasks to work that requires complex judgment and compassionate care. And that's one of the reasons why we're creating the Oracle AI Center of Excellence. It will connect teams of Oracle's top talent and key partners with customers to help them not only leverage the transformative value of AI to solve real-world healthcare challenges, but also to reimagine their business processes, to ensure that there is a return on the investment in AI, that it delivers its intended value. And we're going to hear more about the center this afternoon. This is the first time in my career that I can finally see real tangible change that offers solutions to the root cause of problems that threaten the very sustainability of the global healthcare system. Oracle is using AI to drive transformation across the entire ecosystem, and the results will be nothing short of revolutionary. No other company is taking this end-to-end application of AI. But at the end of the day, we do this for one reason, and that's the patient. Because patients experience the entire system, and there's no better way to understand the transformational change that we're trying to drive than through the voice of the patient. And so today I want to share with you the story of a very special patient, happens to be my next door neighbor for many years, Aiden Brown. Aiden is a 4-time cancer survivor, and he has bravely fought this battle for over 15 years. And that's remarkable in and of itself, but even more so because Aiden is only 20 years old. So let's take a moment to hear his story through the thoughts and experiences from him and his mom and my dear friend, Michelle Brown.
Don't give up. Don't ever give up.
Jim Valvano was a basketball coach. He got diagnosed with cancer. He got an award at the ESPYs.
Time is very precious to me. I don't know how much I have left
Even though he knew he was gonna die, he was urging everyone to enjoy like the gift of today.
Enjoy your life, the precious moments you have.
Whenever I need to pick me up, I watch that.
What's important in life is three things: where you started, where you are, and where you're going to be.
My name's Aiden Brown. I'm from Carmel, Indiana, which is right outside Indianapolis. And basketball is definitely the thing I love most in the world.
I'm Michelle Brown, and I'm Aiden's mom.
Trying to crawl, Aiden?
I think about the early years a lot. We were happy. I had two adorable, sweet, funny, healthy kids. I have a tattoo that says AB squared, Alex and Aiden Brown. It's right on my pulse because they're everything to me. By the time that we had the first sign that anything was wrong, we were already in big trouble. We just didn't know it. The first sign was he had a weak leg, and we went to the pediatrician, and the pediatrician is like, kids have aches and pains. Watch it, see what happens. He had been this happy little, healthy, chubby 4-year-old kid, and he wasn't that anymore. We started noticing that the pain was shifting, and he was getting these low-grade fevers, and I kept on taking him back to the doctor, and I kept on asking questions. And they sent us to our local children's hospital, and we got an ultrasound that day, and that's when they found it. We learned that Aiden had stage 4 neuroblastoma just a few days before his 5th birthday.
Happy birthday to you! Happy birthday, dear Aiden! Happy birthday to you!
It's one of the worst childhood cancers. I knew in that moment that the door was shutting on my old life. I was gonna have to open doors for him. I was gonna have to get him the best care that I could get him because losing him was just not an option.
My earliest memories were mostly tied into my battles with cancer. Most treatment was inpatient. I was spending weeks on end at the hospital. It was around the clock, chemotherapy, radiation, immunotherapy, like you do these treatments and then they make you feel terrible. You're nauseous and in pain and depressed all at the same time. It's pretty miserable.
On the very first night in the hospital, I remember his pediatrician said, "Take care of yourself. This is gonna be a long road." We've been at this for 15 years. I know. Each time the cancer came back, it was different. It showed up wrapped around his left kidney, then it moved to his shoulder and femur bone. The third time it was in a bone behind his eye. The fourth time it was in his cheek.
With each diagnosis, I was more aware of the situation and like how serious it was. I just became an adult kind of faster than I think most kids do.
We used to get all tangled up in these things like, does he get his brother's hand-me-down sneakers? Or do you buy him exactly the pair of shoes that he wants because it might be the last pair of sneakers that he ever gets? And like, it's hard enough for me to manage my own emotions. But then I have to try to help my child not only deal with the physical piece of it, but the emotional piece of it and the grief and the losses, right? We also had Alex, right? We also had another little boy, his big brother that's only 20 months older, who also had his childhood completely disrupted. Everybody in our world was focused on Aiden.
Hello, Aiden. I love you.
From the jump, there were certain treatments that hadn't really moved to the Midwest yet. I've been to a lot of different cities for surgeries and treatments.
We have worked with 6 hospitals in 5 different states. There were so many pieces of things to manage on any given day. There was insurance and billing and coding errors and getting set to collections, and you were inpatient and you were outpatient and you were chemo and you were dressing changes and you were trying to plan a couple of months ahead for surgeries. So I did feel like command center. I want to hold my kid. I don't want to be filling out forms. The stakes are so high. This is my child's life. There have been so many turning points throughout this journey, so many highs, so many lows, really low lows. The cancer has been getting smarter. What's really great now is that the care is getting smarter too. Aiden is a 4-time stage 4 cancer survivor. There really aren't many people like him out there. He's rare. Right now we're in an in-between time, and it's really hard to carve out happiness when you're always holding your breath. But that's our goal. But there's a lot of hope. I know that too, and I'm gonna focus on that.
What Jimmy V said in his speech, just having enthusiasm for life and things that you want to work for, that's super important. I'm about to head off to USC in a couple weeks, and going to college is something I've really looked forward to for a long time. All the experiences that's going to provide, you know, being able to do stuff with basketball and meet new people is something that I'm really, really excited for. And it just goes to show that if you keep the faith, you can push through until your life just drastically improves.
When people say to me, how do you get through life or each day's the same thing? Don't give up.
Don't ever give up.
And now let me welcome Michelle Brown to the stage. Well, as many times as I've seen that video, it doesn't get any easier.
Yeah, for me either.
So Michelle, one of my favorite parts about you living next door was our vegetable garden. And every year we had the best of intentions in planting this vegetable garden, and everybody would help get it set up. And then as the summer progressed, it became literally the worst vegetable garden, the vegetable garden from hell, and an eyesore for the neighborhood. But what I really loved about it was that was the place that you and I would come, right, when no one else wanted to. And we would have a lot of conversations. So for purposes of today, let's just pretend that we are in the vegetable garden.
I loved that vegetable garden. Yeah.
So when Aiden was first diagnosed with stage 4 neuroblastoma, he joined a clinical trial. But I know that there were a lot of other clinical trials. So can you give me a little bit of context in terms of how did that process work in terms of getting on these clinical trials?
So altogether, Aiden was on 3 different clinical trials. The first one came to be because it was what our local children's hospital was offering to us when he was diagnosed. And it was the same trial that all of the hospitals that belong to the children's oncology group were doing. So that's what we did. And we were on that trial for years, and we showed up at what we believed was the last appointment. They were ready to say to us, "We'll see you next year for your annual scan." And they saw something. It was back. The problem was that they had thrown everything that they had at it. They had nothing new to offer us, and I knew that we couldn't do what had just not worked. So I started researching, and it was the old internet, right? And you're going out, and I'm on website to website, children's hospitals, trying to find where they list the clinical trials and trying to understand what I'm reading, getting overwhelmed by what I'm reading because it's awful statistics, trying to understand if Aiden qualified. And at the same time, we had put out a call for help to our network and our support system, and we got lucky because somebody knew somebody that knew this woman named Gretchen, and they connected me to Gretchen, and Gretchen knew about something that might be helpful to Aiden because she helped to fund it. So Gretchen started Cookies for Kids Cancer, which funds pediatric cancer research, and she lost her son, Liam, to neuroblastoma, but she has helped to fund 3 of the treatments that Aiden has been on. So she helped us to get on to that second clinical trial. We were on that trial, and then he relapsed during COVID, and then we got on a 3rd trial, and then last summer, he relapsed again. So I often wonder what our lives would be like if I had not been connected to Gretchen. I specifically think about that this month because it's Pediatric Cancer Awareness Month in September. But what I know is you shouldn't have to know somebody that knows somebody in order to find the latest research and the latest treatment options. And clinical trials equal hope for families like mine and ours. And that information, it needs to be readily available. A parent, a patient shouldn't have to go looking for it, and doctors shouldn't have to go looking for it. It's life-saving, it's time-giving, and it needs to be right there.
And so you talk about going to get care at 6 different sites. Tell me what the process was like moving from site to site and how you've managed the medical record and moving around to these different places.
So, medical records. So in 2010, when we began this journey, it was paper. Everything was paper. So we asked for copies of things, and we collected, and we had this monster folder that we literally carried with us everywhere. And we made the decision very early on that we were going to take Aiden, no matter where it was, we were going to take him to the best care that we could find. So we carried it with us because we never knew if the doctors were going to have what they need. And we knew the story. We knew where everything was in that folder. It got better. Portals, thank you, Seema. It got much better when portals came, but portals don't contain images. And that really became an issue for us last summer when he relapsed. So he had this walnut-sized tumor that they found in his face, and it was tangled up in his facial nerve. And they sent us to a surgeon, and that surgeon was in the same system, so they got to see the images. But very quickly, we decided that we wanted a second opinion. So we put our call out to our network again, and someone connected us to Dr. Moore at the Mayo Clinic in Minneapolis. And we connected with Dr. Moore, and he could only speak to us in generalities, but we really wanted to work with him because he really listened to Aiden and what Aiden's goals were. And he gave us a surgery date, and he still didn't have the scans. And I'm calling, and his assistant's calling. And we're nervous, and we're anxious because you don't want that surgery date to slip, but also the chemo hadn't worked to shrink the tumor, so we're racing against the clock, and the surgeon needs to plan for this very complicated surgery. So it was a lot of stress, and ultimately the good news is that it worked out. Dr. Moore performed the most perfect surgery, got the whole tumor out. The margins were clear, his facial nerve is completely intact, so he was perfect, but the process was really broken. And I learned that Aiden needs those images. They should not be locked up somewhere where he can't get to them, where I can't get to them, where the doctor that needs them can't get to them. So you fixed portals, my friend. Could you fix this one too, please?
We're working on it.
All right, thank you.
But one other piece of this is, so there's the medical data, but I know that you and Chris also had a lot of data yourselves, and you had a system of collecting data about Aiden. So tell us more about that.
Yeah. So it's that folder again, and my husband tried to start to make sense of it. And he started putting things into Excel spreadsheets, things like when Aiden was getting a fever and how long they would last, and his labs and his counts. And we were trying to look for patterns. We were trying to predict and plan because we were trying to have some kind of life in this new normal. And our our life was this 21-day cycle of 1 week we were inpatient for chemo. The second week, he was neutropenic and he had no white blood cells and couldn't fight an infection. And then the third week, he would start to bounce, and we would cram as much life as we could into those few days, and then we would repeat. And so when we started to see the trends, we could start to plan. Could the boys have play dates, or were we on lockdown? I would call the school and say, it looks like Aiden can be there on this day, and they would get the other kids prepared that Aiden's coming to school, and Aiden doesn't look like Aiden, but it's still Aiden, right? Or we would use that to say, like, hang on, buddy, tomorrow you're gonna start to feel better, right? And we would use that for ourselves as well. And so, and then that data became really important when he relapsed again and again, because we had a record and it reminded us of what we were up against and what we did and what we needed to do.
Now, patient-reported outcomes are very, very important. So the other piece of this is that now Aiden is 20 years old. He's going to college. He's at college. And he's now in the driver's seat with his care, right? He's 20 years old. He's making the decisions, but you've got all the data.
Yeah.
So how is that working, and how does that shift feel for you?
Yeah. So Aiden is loving USC. So how perfect is fight on for their motto and mantra, right? It's absolutely perfect. Yeah. All right, Trojans. Woo! So, so I have so much gratitude for all of the people that helped to get us to this point, right? All of the doctors and the nurses and the technicians and Gretchen, right? And her team at the Cookies for Kids Cancer, and our family and our friends. People like you who have shown up for us time and time again. You planned that birthday party that we saw in the video. And when I wasn't sure that I could go out there and face all of those people and pull myself together, you looked me in the eye and you told me, you can do this. Come on, your son needs you. Go out there. It's his 5th birthday. You're going to help him celebrate. And I did, so thank you. So what concerns me? What worries me is that his data is everywhere. It is spread out all over the place, and it's up here, and it's way too important to get lost or forgotten. So he's starting to experience the side effects from the treatment. So understanding what he's been through as more and more treatments or side effects reveal themselves. And as we're in this journey to know what we've tried before and what worked and what didn't work, that's really important. And now he's 2,000 miles away from me. And I'm always going to show up for him. I'm always going to be there for him. But he needs his data when there's an emergency. So that really concerns me, that he won't have his data, and that now he'll be working with his 7th hospital out on the West Coast, that they won't have his data when they need it. The other thing that really concerns me is that there won't be a treatment for him when he needs one. And that probably scares me the most, because he's incredibly rare, right? He's a unique case, and all cancer cases are unique. And I never thought that this would be my life. I never thought that this would happen to my child. And I didn't understand that pediatric cancers are not junior versions of adult cancers, right? So, and I didn't understand that there wasn't enough clinical research. And so I'm concerned that there won't be a targeted treatment, a specific thing that will help Aiden when we need it.
So we're at a tech conference, and we're hearing a lot about AI. How are you thinking about AI, and what do you want? What do you hope that AI will do for you and for other patients?
So AI has taught me that anything I think I can do, it can do better and faster, and so that's amazing. I know how much time that I have spent researching and analyzing and how much time that took me, and yet I still worry about what I missed, what I might not have found, or what I didn't see, or what question I didn't know to ask. And you have always said to me that you believed that the secret, that the answer is probably somewhere in his data, all this data. And no one has ever seen it, right? 15 years, and it's spread out all over the place, and not one person, not even me, has seen it all. And we know that he's rare. He's a stats guy, and he collected all of these stats from his doctors, and by his calculations, he's 1 in 2 million. And no one disputes that. And I think about if we dug into that data, what we might learn about Aiden, for Aiden, but also for all the other kids, right, that we could learn about. And so, what do I hope? I'm gonna look at you, audience, for the first time, because I've been really nervous to look at you. I hope that AI becomes your superpower. And they have told us that it's not if, it's when the cancer comes back. So I hope it becomes your superpower, and that I hope that when he needs it, you help him. That's what I hope. Thank you. You okay?
Well, Michelle, you have raised 2 incredible young men. I know them well, and they're good people, and they are very lucky to have you in their corner and to have you as their mom. And I want you to also know that when people in our community got diagnosed with cancer, that I know every single one of them thought of Aiden, and they thought about how brave and how resilient he was, his incredible attitude, and I know that that helped them. It made them stronger when they had to face their own journey. So as difficult as this has been, I hope you know that he gives incredible inspiration to so many people. I've been working on these things for a very, very long time, and I can tell you I'm not giving up. Oracle's not giving up. And the issues that you have raised are things that are solvable, and I think we're solving them. So I'm really excited about our next panel, because you're going to see how we are trying to fix this problem. So with that, I'd like to invite Mike Cecilia and Nate Gross from OpenAI. Thank you.